Hello dear patients. Today we are going to review the clinical case presented on the picture. This is a mole on a woman's body. It got traumatized quite often. It grew and was slightly painful. She was also afraid of irregularity of its color, so the patient came to dermatologist into our clinic. On observation we see irregularity of color, bleeding. You see expanded blood vessels, telangiectasia. This indeed is a mole. It contains melanocyte cells. It is a nodule that has yellow-brown color with telangiectasias, expanded vessels, and it is an intradermal nevocellular nevus. That is, the cells of nevus are located inside the skin under epidermis, the top layer of skin. You can watch a separate, more detailed video about what intradermal nevocellular nevus is on our channel. We are not going to cover it now. In this patient, it developed by the age of 20 years, and this often scares patients as well as our patient, as many people think that moles develop from childhood. However, it's not always the case. In our case, this wasn't so. This was normal, as these nevuses develop from the ages of 10 to 30 years. Considering that there is tenderness of this nevus, its bleeding, frequent traumas, irregularity of color, all this is an indication for removal. So after oncocytology is a scraping from the surface of this mole for oncology, and after analysis for C100 protein, again you can watch a separate video on our channel about what it is, this is a specific blood analysis. After normal results of these analyses are acquired, a removal was done with radio-weight method under anesthesia by lidocaine solution, that is an injection. So you can see a separate picture showing how this mole looks like after removal. What is histology? This is putting this mole into formalin or other disinfectant solution. In our case this was formalin, and it's transferred into a laboratory where the internal build-up of this mole is examined. This was mandatory to do so in case of such mole and such indications. According to histology, this mole didn't yet transfer to melanoma, and a diagnosis of intradermal nevocellular nevus was set. After removal, the patient came for repetitive consultation, as a result of which a gradual healing was seen by the method of superficial scar. There were no repetitive relapses of this nevus. Finally, I'd like to say that any mole that grows and induces tenderness, itch, it traumatizes, etc., all this is an indication for removal of such moles. In Europe, dermatologists think that any mole that bothers the patient somehow, even without any external signs of malignancy, has to be removed. I support this point of view, particularly as there are so many indications in this particular patient. If it is necessary to diagnose and remove, as well as to do analysis for malignancy of any moles on the body and on other areas of skin, you can consult dermatologists and dermato-oncologists of our paid medical center of Dermatov-Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such neoplasms. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.